Good afternoon, my good people. We are still tackling our topic whereby we were discussing in our previous video. We were discussing about types of breast lumps. And today we will continue with the same subtopic because I want each and every one of you who had requested this topic to get what he or she was looking for. It's not always meant for women because even men have breasts and they cannot, as we said in our previous topic, breast lumps can also appear in men. And before we continue, if you are watching this video for the first time, take a second or two and press the subscription button, and after subscribing, make sure you put the notification bell on so that whenever I produce a video like this, YouTube will automatically notify you. For the returning subscribers, thank you for supporting this channel, because if it were not for you guys, this channel could not be where it is at the moment. So let's continue pushing it forward so that we may continue getting more education and the community will benefit from this. So let's get back to our topic about the types of breast lumps. The 51 is what we call breast cancer. We had already started talking about this subtopic. It's just a continuation. So, in breast cancer, study has found that 75% is a big number or a big percentage. So study has found that 75% of breast biopsies come back with a benign result, which means that majority are non-cancerous. Remember, when we were talking about biopsies, we said that biopsies mostly are used to rule out cancer and cancer cells. So, most of these breast lumps are benign or are non-cancerous. That's why we are saying that study has found that 75% of breast biopsies, or the pieces cut from a breast which has a lump, come back with a benign result, which means that majority are non-cancerous. So out of 100%, only 25% turn to be positive for cancer. So if you find a lump in your breast, especially during your menstrual cycle, don't worry very much, because according to study, 75% of breast biopsies come back with a benign result, which means that majority are non-cancerous. A point to note: breast cancer is easier to treat when diagnosed at an early stage, and this is normal to any disease. When a disease is diagnosed or known in its early stages, before it becomes chronic, it's easier to manage or to treat. And the same way, when breast cancer is diagnosed at an early stage, it's very easy to treat. Breast cancer is easier to treat when diagnosed at an early stage. According to the National Cancer Institute, the 5-year relative survival rate for localized female breast cancer is 99%. That means when diagnosed early, it can heal almost 100%. According to the National Cancer Institute, according to the National Cancer Institute, the 5-year relative survival rate for localized female breast cancer is 99%. That means When diagnosed early, it can be managed on time and get healed or kill the cancer cells. Let's go to number 6, or the sixth cause of uh, breast lump, and this is what we call costochondritis. Costochondritis, costochondritis and Sins syndrome, costochondritis and Tens syndrome. I hope you get this. Some of these medical terms are very hard to pronounce even, but it's costochondritis and Tens syndrome. These are similar conditions involving inflammation of the costochondral joint. And where is the costochondral joint found? Costochondritis and Tens syndrome. These are similar conditions involving inflammation of the costochondral joint. Costochondral joint is the cartilage that joins the ribs to the breastbone or sternum. I hope now you understand where the word costochondritis comes from. And as I always say, if you see any word having an itis at the end, it means there is an inflammation. Itis means inflammation. So costochondritis and Tens syndrome, these are similar conditions involving inflammation of the costochondral joint. Costochondral joint is the cartilage that joins the ribs to the breastbone or sternum. Both conditions can cause visible swelling and pain, especially when you move or apply pressure. Both conditions can cause visible swelling and pain, especially when you move or apply pressure. There is an inflammation, meaning there is also an active infection. When there is an inflammation, there is the compression of the nerves, and this has to cause pain because the nerves are the ones that sense pain. Even if you pinch your body or you pinch somebody, he or she will feel pain because of the sensory nerves, which will sense that you have been pinched and will send the impulses to the brain so that you may sense the pain. So costochondral joint is the cartilage that joins ribs to the breastbone or sternum. Both conditions can cause visible swelling and pain, especially when you move or apply pressure. And the causes include the following. The causes of costochondritis and Tens syndrome. Number 1, chest strain. Chest strain. Chest strain due to severe coughing. That is the first cause. Number 2, we have chest strain from physical activity. For example, when you are doing strenuous exercises. Number 3, we have injury to the chest. And number 4, infection. As I have said above, there must be an active infection. Let me repeat the causes of this costochondritis and Tens syndrome. Number 1, chest strain due to severe coughing. Number 2, chest strain from physical activity, for example, exercises. Number 3, injury to the chest. Maybe you may get an accident and get an injury. And number 4, we have an infection. So, we pose this question: when to conduct a doctor? When to conduct a doctor? Although a lump near the bra line may be harmless, it's a good idea to get new lump examined by a doctor. Although a lump near the bra line may be harmless, it's a good idea to get new lumps examined by a doctor. Some breast lumps, even if they are benign, may require treatment. Some breast lumps, even if they are benign or non-cancerous, may require treatment, especially when there is an infection. Contact your doctor as soon as possible if you see the following. Contact your doctor as soon as possible if, number one, the lump is painful. Remember, we have said it can be painless. Number two, the lump or area around it is red or hot. And when it's red or hot, it means there is an active infection. Number three, if you have fever. Number four, if you have other symptoms such as puckering skin, nipple discharge, or inverted nipple. If you have other symptoms such as puckering skin, nipple discharge, or inverted nipple. Number five, if the lump is hard and movable when you punch with your fingers. If the lump is hard and movable when you punch with your fingers. Number six, if the lump is changing or growing. If the lump is changing or growing. And the last one, if you have chest pain. Let me repeat this again. Contact your doctor as soon as possible if the lump is painful, the lump or area around it is red or hot, if you have fever, if you have other symptoms such as puckering skin, nipple discharge, or inverted nipple. Number five, if the lump is hard and movable when you punch with your fingers. And number six, if the lump is changing or growing. And number seven, if you have chest pain. This marks the end of our video today. Let's continue subscribing, liking, and sharing our videos so that they may reach as many people as possible, and our channel will grow bigger and continue giving you these educational bangers endlessly. Let's have a wonderful day ahead.